Hello everyone, welcome to Vet Imaging Lab. In today's lecture, we will explore how veterinarians use ultrasound in clinical practice. Now, let's talk about the basic principles of how ultrasound works. Ultrasound imaging is based on high-frequency sound waves. These waves travel through tissues and reflect back when they encounter different structures. The amount of sound reflected, known as echoes, determines the grayscale image seen on ultrasound. The high-frequency sound waves are usually measured in megahertz. The frequency of these waves determines how detailed the image will be and how deeply it can penetrate the body. Higher frequencies give sharper images but don't reach deep structures, while lower frequencies penetrate deeper but with less detail. How ultrasound images are formed. Ultrasound imaging begins with the transducer, which plays a dual role. It emits high-frequency sound waves into the body and then receives the returning echoes that bounce off different tissues. The first step in ultrasound imaging is sound production. The transducer generates the sound waves into the body. When the ultrasound beam enters the body, it can either pass through or be attenuated, meaning it loses energy as it travels. Attenuation occurs in different ways. Some waves transmit through tissues with little interference, like when passing through fluid. Some waves are reflected back to the transducer. Others are absorbed, reducing the signal. Some waves change direction, a phenomenon called refraction. Others scatter in multiple directions, affecting image clarity. Among these interactions, reflection plays a key role in ultrasound imaging. When sound waves strike gas or bone, a large amount of echoes return to the transducer, making these structures appear bright on ultrasound. These interactions determine how different structures appear on an ultrasound image, allowing us to distinguish tissues based on their echogenicity. After interacting with tissues, some of the ultrasound waves return to the transducer as echoes. Then the transducer detects the returning echoes and sends the data to the ultrasound machine. The ultrasound system processes these signals into a grayscale image, displaying structures with varying echogenicity. The strength of these echoes determines how bright or dark different structures appear on the image. Strong reflections create bright areas. Weak or absent echoes result in darker regions. This is how ultrasound provides a real-time image of internal structures. Now, let's take a closer look at the key factors that influence returning echoes and how they determine the brightness of an ultrasound image. As you know, echogenicity refers to how much sound a tissue reflects back to the transducer, and reflection is the key factor in ultrasound imaging. The strength of these reflected echoes depends on two main factors. First, the acoustic impedance difference between adjacent structures. Second, the angle of incidence. These terms might seem a bit technical, but don't worry. Let's break them down one by one and see how they affect ultrasound imaging. One of the key factors in ultrasound reflection is the acoustic impedance difference between adjacent tissues. Let's talk about acoustic impedance and what it means in ultrasound imaging. Acoustic impedance refers to how much resistance a tissue offers to the passage of sound waves. Different tissues have different impedance values, depending on their density and stiffness. When sound waves travel from one tissue to another, the difference in acoustic impedance between the two determines how much sound is reflected and how much continues to pass through. Therefore, as you can see here, a large impedance difference like between soft tissue and stone or soft tissue and air results in strong reflection, creating bright echoes on the ultrasound image. In contrast, a small impedance difference, such as between similar soft tissues like the kidney or between soft tissue and fluid, like the liver and gallbladder, results in less reflection. This allows more sound to pass through, appearing darker on the image. For example, in this ultrasound image of the kidney, the renal cortex and medulla have similar impedance, so only a small amount of sound is reflected. This makes the medulla appear darker compared to the cortex. Similarly, in the liver and gallbladder image, the fluid inside the gallbladder has a much lower impedance than the surrounding liver tissue. As a result, almost all sound waves pass through without reflecting back, making the gallbladder appear completely black, anechoic. This demonstrates how a smaller impedance difference leads to less reflection and darker echoes on ultrasound. Another key factor that affects reflection is the angle of incidence. This refers to the angle at which the ultrasound beam interacts with a structure. When the beam reaches an interface, which is the boundary between two different tissues, the angle of incidence determines how much sound is reflected. If the beam strikes the interface at a perpendicular angle, or 90 degrees, most of the sound waves are reflected directly back to the transducer, creating strong echoes and a brighter image. However, when the beam strikes at an oblique angle, more sound waves are deflected away instead of returning to the probe. This can result in weaker echoes, or even the loss of some structures on the image. So far, we've talked about how reflection plays a key role in ultrasound imaging. Now, let's see how this applies to actual ultrasound images. As we've discussed, the brightness of an ultrasound image depends on the amount of reflected echoes. This brightness can be categorized into 4 levels: hyperechoic, isoechoic, hypoechoic, and anechoic. Here we have examples of hyperechoic structures, which appear bright because they reflect most of the ultrasound waves. Commonly observed hyperechoic structures include stones, gas, fat, bone, and metal, as they strongly reflect sound waves and produce bright echoes on ultrasound images. On the left, we see a bladder stone. Since stones are dense, they create strong echoes, and you can see the acoustic shadow behind it where no sound waves pass through. In the middle, we have gas in the stomach. Gas also produces strong reflections. On the right, we see a myelolipoma in the spleen. Fatty tissues like this tend to be more reflective than surrounding soft tissues, making them appear hyperechoic on ultrasound. When tissues have similar echogenicity to their surroundings, they blend in with adjacent structures. In ultrasound, we describe these as isoechoic tissues. Let's look at these 2 ultrasound images from different dogs. At first glance, do both livers appear isoechoic? No. On the left, we see a normal liver with typically homogeneous echogenicity, a little dark. On the right, however, we see a case of steroid hepatopathy. Here, the liver's echogenicity is increased due to excessive glycogen accumulation in hepatocytes, making it appear brighter than normal. In this situation, we cannot say that both livers are isoechoic. Now, let's focus on hypoechoic structures. These appear darker on ultrasound because they reflect fewer sound waves. On the left, we have a normal kidney. Notice the cortex appears slightly brighter, while the medulla is more hypoechoic than the cortex, meaning it appears darker. On the right, we see a case of acute pancreatitis. In this image, the pancreas appears more hypoechoic than usual, with darker areas scattered throughout the parenchyma. This occurs due to inflammation and edema, which increase fluid content in the tissue, reducing echogenicity. Anechoic structures appear completely black on ultrasound because they do not reflect sound waves. On the left, we see the urinary bladder. Since urine is a fluid with no internal echoes, it appears uniformly black. The bright white outline represents the bladder wall, which reflects the sound waves. In the middle, we have a normal kidney. The renal cortex and medulla have different echogenicities, but there are no anechoic areas within the parenchyma. In contrast, on the right, we see a case of polycystic kidney disease in a cat. Notice the multiple fluid-filled cysts scattered throughout the kidney. They appear numerous anechoic, round structures. As we have explored so far, in ultrasound imaging, brightness reflects tissue composition. So understanding echogenicity and recognizing changes in echogenicity are crucial for assessing disease conditions. Now, let's summarize echogenicity along with examples of typical tissues that correspond to each echo pattern on ultrasound. Hyperechoic structures, such as bone, gas, and fat, appear bright due to strong reflection. Isoechoic structures have similar echogenicity to their surroundings, blending in with adjacent tissues. Hypoechoic structures appear darker and are often seen in soft tissues. anechoic structures appear completely black, commonly observed in cysts, blood, and urine. In ultrasound imaging, understanding artifacts is crucial for interpretation and accurate diagnosis. In this lecture, we'll briefly cover three important types of artifacts, but we'll explore them in more detail in the next lecture dedicated to ultrasound artifacts. Acoustic shadowing occurs when ultrasound waves encounter a highly reflective surface like bone or gas. This results in a dark shadow behind the object, as seen in the left image. Let's talk about reverberation artifact. In cases where there is a large amount of gas, like in the left image, ultrasound waves encounter gas bubbles and get reflected multiple times before returning to the transducer. These repeated reflections result in multiple bright, linear echoes that appear as evenly spaced, parallel lines. We see an example of this artifact in a gas-filled intestine. The ultrasound waves are reflecting multiple times within the gas-filled area, producing the characteristic bright, parallel lines. Since reverberation artifacts primarily occur at highly reflective interfaces, they are commonly seen with gas or metal. Before we move on, let's take a step back and think. In gas-filled areas, we can observe both acoustic shadowing and reverberation artifacts, depending on how the ultrasound waves interact with the gas. As you can see in this image, some areas distal to the gas appear dark due to shadowing, when most of the ultrasound waves are reflected, while other regions show bright, repetitive echoes due to reverberation, when sound waves bounce multiple times between gas bubbles. Understanding these differences helps in distinguishing artifacts and avoiding misinterpretation in clinical practice. Enhancement artifact occurs when ultrasound waves pass through a fluid-filled structure, such as the bladder, gallbladder, or a cyst. Since fluid does not significantly attenuate sound waves, more sound waves pass through, resulting in increased brightness in the area behind the fluid-filled structure. As you can see in the image, the region distal to the gallbladder appears brighter than the surrounding liver tissue. Recognizing enhancement artifacts is helpful because it provides a key clue that the structure contains fluid. This helps differentiate cystic structures from solid masses, improving ultrasound interpretation. Before we conclude, let's summarize the key points from today's lecture. Ultrasound imaging is based on sound wave reflection and tissue interaction. Understanding this fundamental principle helps in interpreting images correctly. Echogenicity plays a crucial role in image interpretation. Recognizing hyperechoic, isoechoic, hypoechoic, and anechoic structures allows for better differentiation of tissues. Being aware of artifacts helps prevent misdiagnosis. Recognizing common artifacts, such as acoustic shadowing, reverberation, and enhancement artifacts, is essential for accurately interpreting ultrasound images and understanding the structures being evaluated. Mastering these concepts will enhance your confidence in ultrasound interpretation. That concludes today's lecture. I hope this session helped you better understand the fundamentals of ultrasound imaging and interpretation. If you found this lecture useful, be sure to check out more educational content on Vet Image Lab, where we have a variety of lectures about veterinary diagnostic imaging. Thank you for watching, and I'll see you in the next lecture.